The American Academy of Pediatrics is calling President Trump's recent remarks about autism, quote, dangerous and misleading.
But with Tylenol, don't take it. Don't take it.
President Trump and members of his administration once again shook the medical community when he announced an association between childhood autism and acetaminophen.
Commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good.
Currently, there is no new scientific information on autism spectrum disorder related to acetaminophen. The White House cited 3 peer-reviewed studies, 2 from 2019 and another from 2022, which were published in credible scientific journals. All 3 found an association between acetaminophen use during pregnancy and risk of adverse birth outcomes like ADHD or autism. In the context of medical research, an association does not equal cause. And in each of those scientific studies, the researchers stated more scientific investigation is needed. The White House also mentioned a research paper from this past summer, which analyzed 47 international studies. That paper also concluded there is an association, but no definitive causation. The strong warning from the Trump press conference was significantly toned down in a letter to American doctors from FDA Commissioner Martin Makary. It said the causal relationship between acetaminophen and autism has not been established, but suggests doctors, quote, consider minimizing the use of acetaminophen during pregnancy. A former CDC official weighs in on Tylenol use in pregnancy. The former head of the agency's National Center for Immunization and Respiratory Diseases says he thinks President Trump is listening to Health and Human Services Secretary Robert F. Kennedy Jr. for guidance on this issue. But the official warns RFK Jr. has a history of mis- and disinformation and says he wants to see the data and evidence Kennedy claims to have.
OBGYNs have always told their patients to be cautious about using any drug, including acetaminophen, in pregnancy. So, we need to see the work. And if we're not seeing the work, that is neither gold standard science, nor is it radical transparency, which seem to be really the emphasis of what Secretary Kennedy talks about.
Kennedy says FDA will start the process to make a safety label change.